Did you know that a vitamin costing less than $5 can improve your erection better than those $100 supplements? I'm talking about folic acid, folks, and today I'm going to tell you exactly how to use it. I'm Dr. Claire Whitman, and I've been working as a urologist here in Toronto for over 20 years. I've seen countless men walk into my clinic feeling defeated, thinking their intimate life is over just because they've hit 60 or 70. But here's the thing, it doesn't have to be that way. Erectile dysfunction isn't a punishment for getting older. It's your body telling you something needs attention. And sometimes the solution is simpler than you'd think. That's where folic acid comes in. And honestly, it's one of the most underrated tools we have. So what exactly is folic acid? It's vitamin B9, and it does 3 crucial things for your body. First, it improves blood circulation. And better blood flow means stronger erections, plain and simple. Second, it helps produce nitric oxide, which is essential for getting and maintaining an erection. Third, it supports cellular energy, which means more stamina when it matters most. Now, let me give you the specifics, because I know that's what you're really here for. The typical dose is 400 to 800 micrograms per day. Take 1 tablet in the morning on an empty stomach with a glass of water. You can also take it with a light meal if that works better for you. But here's the key. You need to be consistent. This isn't like those pills that work in an hour. You're looking at 6 to 8 weeks before you notice real changes. And please, before you start taking anything, talk to your doctor. They can adjust the dose based on your age, your blood work, and any other medications you're taking. This is important, eh? I had a patient last year, a 72-year-old gentleman from Mississauga who tried everything. He was frustrated, his partner was frustrated, and he'd pretty much given up. I suggested folic acid along with some dietary changes. 8 weeks later, he came back with a smile I hadn't seen in years. He told me, "Doc, I feel like I'm 50 again." That's the power of working from the foundation up. Now you might be wondering, what about Viagra or Cialis? Look, those medications work, and they work fast. But they're treating the symptom, not the cause. They're also expensive and can have side effects like headaches, flushed face, or upset stomach. Folic acid, on the other hand, is addressing the root problem, your body's ability to produce what it needs for healthy function. And the best part? It costs about the same as a coffee at Tim Hortons. Can you combine them? Absolutely. Many of my patients use folic acid as their daily foundation and keep the prescription medication for special occasions. It's not an either-or situation. You should also know that folic acid works even better when you combine it with the right foods. Load up on leafy greens like spinach, legumes like lentils, broccoli, and citrus fruits. These foods naturally contain folate and support what you're doing with the supplement. Now, a few important notes. If you're on blood thinners, have a history of cancer, or have kidney problems, you need to be extra careful and definitely consult your doctor first. Most people tolerate folic acid really well, but everyone's different. And guys, I'll be honest with you, this isn't magic. If you're smoking a pack a day, drinking heavily, and not moving your body, folic acid alone won't fix everything. You've got to meet it halfway. Cut back on the booze, get some exercise, manage your stress. Your body wants to work properly. You just need to give it the right tools. The reason nobody talks about this more? There's no big money in promoting a $5 vitamin. Pharmaceutical companies invest millions in medications they can patent and sell for top dollar. But just because something's cheap doesn't mean it's not effective. So here's what I want you to do. Talk to your doctor about adding 400 to 800 micrograms of folic acid to your daily routine. Give it a solid 8 weeks. Combine it with healthier eating and a bit more movement, then come back and let me know how it goes in the comments below. If you found this helpful, hit that subscribe button because next week I'm sharing 5 exercises that can improve your erections naturally. No equipment needed, and you can do them right at home. Trust me, you don't want to miss that one. Thanks for watching, folks, and remember, taking care of your health is always worth it.